Hi, hello, we're back.
Yeah.
So this is the Zoom. Right after the 40 minutes, it's going to end. Okay, just bear with me. I'm going to give you these slides. Okay, so we are going to talk about the fundamentals of nursing right now. Fundamentals of nursing aid. So, okay, so we are in the fundamentals of nursing aid. So it's okay, you can follow. Where is Yilna? Because we have one other nationality now, so that's why we are going to talk in English. So Yilna is there. So it is okay lang sa inyo, mga kabayan ko? Nakaka-follow tayong lahat?
Copy.
Or magtataglish ako?
English.
It's okay na purely English tayo? Or itataglish ko para may ma-i-explain ko na maintindihan nyo?
It's up to you po.
Okay. So everybody okay with that? Just a minute.
Yeah. Yes po.
So sino ang merong gusto sa inyo? Who among you? Where is Yilna? Yilna, are you okay? You can follow? Where is Yilna? Yilna, you can follow? Where are you? Okay, so we are going to continue. We'll proceed with the fundamentals of nursing. So in fundamentals of nursing, we want to study about the vital signs, okay? Number one is the vital signs. We talk about like the basics of the nursing aid are those activities of the daily living. And one of those is to take the vital signs. So what vital signs stands for? What is the meaning of the vital signs? Vital signs are the clinical measurements, specifically pulse rate, temperature, respiration rate, blood pressure that indicates the state of a patient's essential body functions. The important component of the patient care. Why it is important? Because all of those patients who are coming to the hospital or any healthcare facility, it needs to determine which treatment protocols to follow to provide critical information needed to make life-saving decisions and confirm feedback on treatments performed. So it is important as a component of the patient care because it only determines what the doctor is going to provide with the protocols of treatment. So it depends on the vital signs. Okay, so the accurate documentation of the vital signs are very important baseline to determine patient's condition. So when the patients are coming to the healthcare facility, the first and foremost vital signs is to be taken. With fever or without fever, patients are going to have their vital signs being done. And it is not only the 4 vital signs that we are talking about. We are talking about the 7 vital signs. It is routinely monitored by the medical professionals like nurses, doctors, nursing aides, and healthcare providers, which includes the following: These are the vital signs: the body temperature, the pulse rate, respiration rate, the blood pressure, which is actually, it is not considered as vital sign, but it is often measured along with the vital signs, so it is already included. Oxygen saturation is another one, and the weight and the height of the patient. So all of these 7, just remember, we have 7 vital signs to take. So don't forget that these 7 vital signs are vital to the doctors and to the other healthcare medical professionals, because this one is a baseline to determine whether the patient's condition is good or not. So again, there are 7 vital signs: body temperature, the pulse rate, the respiration rate or the rate of breathing, blood pressure, oxygen saturation, weight, and height. Okay, so we have 7. Bed making is another fundamental or basics of the nursing aid. So bed making is the act of arranging the bed sheets and other beddings on a bed to prepare it for use. Okay, so we are going to make our beds for the patients. So it is important nursing technique to prepare various types of bed for patients or clients to ensure comfort and useful position for a particular condition. So we are going to make a bed for the patients. It depends on their condition. We have to prepare those beds. Okay, so we have the types of bed making in a hospital. When I say it is types of bed making in a hospital, it refers to all facility like the healthcare facility. So when you are in the home care, it is also the same as you are going to prepare it for the home care. If you are also in the medical clinics, the same way you are going to prepare it when you are in the hospital. So we have the simple bed or unoccupied bed or the open bed. The closed bed or the occupied bed. Cardiac bed are those bed makings that we are going to prepare for those patients who have the heart problems and those who are operated with heart. So we have the Fowler's bed or those bed with the sitting position for the patients who are sitting positions. The fracture bed are those beds, those patients who are having the problem or the broken bone problem with orthopedic. Operations bed are those beds we are going to prepare for those patients going to be, when we receive those patients coming from the operation or the operating room. So bed making is number 2. So number 3, basics or fundamentals of nursing aid, we have the patient mobilization or mobilization. Early mobilization and sitting out of bed will increase the blood flow in the limbs and internal organs of the patients. Okay, so why we are requiring the patient to move right after 24 hours of operation? Because we want them to have the increase of blood flow in their limbs and in their internal organs. So increasing the blood flow and removing the pressure on the limbs and other parts of the body can also prevent bed sores from developing. Okay, so the poor immobilization or immobilization of the patient, especially those who are bedridden, if you will not move them or their position in the bed, they will cause a bed sore at their backs. So this indicates a poor nursing care. Okay, a poor nursing care indicates when there is already a bed sore at the back of the patient. That means to say you are not able to position your patient to the left, to the right, you are not moving the patients. Okay, so ambulation is stop circulation, stimulates circulation rather, which can help stop the development of stroke causing blood clots. Why we are requiring your patients to ambulate? Ambulation means to walk. So it stimulates the circulation. It helps them stop the development of the stroke causing blood clots. So while, if you can see, while in the airplane, we are asked to move. We are asked to stand. So the same way with the patients who are already on bed for a long time, we want them to ambulate. So this ambulation stimulates circulation, which helps them to develop, stops to develop this stroke causing blood clots. So walking or ambulation improves blood flow, which aids in quicker wound healing. Okay, so why we need to ask the patient to ambulate? So because walking improves blood flow. Poor moving and handling practice can lead to back pain and musculoskeletal disorders, which can lead to inability. For longer time, when you keep the patients just lying on bed without moving, without ambulating, so you are leading the patient to have a back pain or any musculoskeletal disorders. So which leads them to inability, unable to walk. So ambulatory devices. So we have the ambulatory devices. They are orthotic devices used for support. So they can augmentation. They augmentate it's going to add, to enhance the muscle action and or reduction of weight bearing load. So maintaining stability and balance with the aim of transferring individuals with ambulatory difficulty from one point to another due to injury or disability. So as the nursing aides, we are going to provide them ambulatory devices. We are going to help them or assist them while walking, while ambulating with the help of these ambulatory devices. So mobility aids. These are the ambulatory devices or the mobility aids. It includes items such as walkers, canes, crutches, manuals, and electric wheelchairs, and motorized scooters. Walking aids, they are tools designed to assist walking or enable mobility. So they are the aids. They can help the patients who are unable to walk to walk, to ambulate. So they are, examples are the Zimmer frames, the wheeled rolling walkers or rollators are other devices designed to assist people or to assist patients having difficulty in walking. So down below, you can see the photos of those mobility aids. Crutches, they are being used when the patient is unable to walk with both legs. Okay, crutches, you know, is going to be used on their armpits. The elbow crutch, when the patient is going to walk with one foot, broken one foot, so he or she is going to use the elbow crutch alone. Walking canes, especially those elderly, they are using the walking canes. So either these walking canes have the rollers or they are just the firm one. The Zimmer frames, they are with the rollers and they are with wheels. So they can support, those patients to walk properly. Rollators are being used also as mobility aids because this is almost electric operated. Number 4 is the patient safe handling or the manual handling. Moving and handling, also known as the manual handling of the patient, is any action involving physical effort to move one patient or to support them in one place going to another place. So we have the techniques, or we have the methods or way by means we are going to handle safely the patients. We have the lifting, when we are going to lift them up. We are going to have the pushing, the pulling, maneuvering or rotating, steadying when you keep them from the bed and just to stand still, carrying them from one bed to the wheelchair, or from wheelchair to the patient's bed, and transporting them, like carrying them from the room to the bed, from the bed to the ambulance. So these are the transporting. So patient safe handling and manual handling. So we are talking about the lifting and transferring, pushing, pulling, maneuvering, and carrying. So these are the photos that you can see how in a healthcare facility we will be able to lift and transfer the patient from one place to another. In this photo, in the first one, those healthcare providers, they are transferring the patient, lifting the patient, and transferring them to, from the operating trolley down to the patient bed. So down below is the nurse there is transferring the patient from the bed to the wheelchair. So there are methods or techniques that we are going to do while doing all of these techniques. Pushing. So you can see here, this guy is pushing the patient bed with the two hands. So all of this we are going to use in a practical way, in an actual way. Pulling, you can see that he pulls, from when he is in front of the patient trolley. And maneuvering is rotating. You are not going to put the patient just coming from the bed to the wheelchair. No, you have a technique that to be followed from maneuvering to rotate the patient properly, or else you might break his hip or you might break his knees. Okay, while carrying, this is almost the same as carrying with two persons because you cannot carry one patient alone. Number 5 is enteral feeding. One of the basic fundamental of the nursing aid is to provide the enteral feeding, to give food to and supply with the nourishment. Enteral feeding refers to the intake of food via the gastrointestinal tract. When we say gastrointestinal tract, we refer to through the mouth, through the mouth or through the nose, through to the stomach. So this is the gastrointestinal tract by the use of the tube. So enteral feeding is by the use of the tube. So the intake of food from the mouth or from the nose to the stomach, to the gastrointestinal tract. The GI tract, or we call it as the gastrointestinal tract, is composed of the mouth, the esophagus, the stomach, and the intestine. So these are the components of the gastrointestinal tract. So when we provide feeding, enteral feeding for our patients, so we will be providing food via tube, yung nasogastric tube. Okay, from the mouth or from the nose directly to the stomach by the use of the tube. So the main types of enteral feeding tubes. So we are talking about the tubes here. Enteral feeding, remember it, by the use of the tubes. The main types, number 1, we have the nasogastric tube, or we call it as abbreviation NGT, nasogastric tube. It starts from the nose and it ends in the stomach. So the tube itself, you will insert the tube from the nose to the from the nose directly to the stomach, and you will give the enteral feeding. Number 2 is the orogastric tube or the OGT. OGT starts from the mouth. Oro means mouth, and it ends in the stomach. So if those patients are um, having oxygen via the nasal prong on their nose, so you will not be able to put the other tubes, so we are going to make the patients uncomfortable then. So we will just put the tube instead to the mouth. So we will be using the mouth to the stomach, and we will be using the orogastric tube. Number 3 is the nasoenteric tube. It starts in the nose and ends in the intestine. Subtypes, it includes the nasojejunal and the nasoduodenal tubes. Number 4 is the oroenteric. Naso means nose. Okay? So nasoenteric. Oro means mouth. So from the mouth to enteric, to the intestine. Number 5 is gastrostomy tube. So this tube is placed through the skin. They are going to use the laparoscope to insert a tube from the skin of the stomach, go in the abdomen, going straight to the stomach. Usually, those patients in the home care are having this PEG tube, the percutaneous endometrial gastrointestinal tube. So they are using this permanently or temporarily for those patients in the home care. So you are going to take care of patients with gastrostomy tube when you are going to be placed or working in a home care. Most patients are having PEG tube. They are calling it PEG tube. Jejunostomy tube is another one, which is placed through the skin of the abdomen, straight also into the intestine. This jejunostomy tube is to the intestine. Gastrostomy tube is through the skin via the abdomen to the stomach. Okay, so we got it. We have the 6 main types of enteral feeding. And enteral feeding is feeding by the tube to the gastrointestinal tract. Going forward, this is the photo of the enteral feeding and the parenteral feeding. To the left is the enteral feeding that I am talking to you about. So it comes from or through the nose or through the mouth down to the stomach. Okay, so here is the stomach here. So that is the nasogastric tube. And the nasoduodenal, nasojejunal to the intestine. Gastrostomy tube is the incision they put on the abdomen. So with the jejunostomy. Gastrostomy tube is opening to the stomach. And jejunostomy is opening to direct to the intestine. Okay, to the right is the parenteral feeding. Let's talk about parenteral feeding. We have done with the enteral by the tube, and now we are going to have the parenteral feeding, which is abbreviated as PN, parenteral nutrition. It is an intravenous feeding. It is a method of getting nutrition into your body through your veins. You are surprised that there is a parenteral feeding. The feeding is going through the vein, through a tube that is inserted from the subclavian, the big vein in here, going to directly to the stomach. So parenteral feeding is feeding via intravenous feeding. It depends on the vein, which vein is going to be used. And this procedure is often referred to as either total parenteral nutrition or TPN or peripheral parenteral nutrition or PPN. So you have the difference now between the enteral and the parenteral. Okay, so parenteral nutrition or intravenous feeding may include all these: protein, carbohydrates, fats, minerals, electrolytes, vitamins, trace elements. these are the required, food for the patients who cannot eat. So we are going to put it in a plastic container or a bottle, and through this, they are going to be passed through the vein, through the tube, through the vein to the stomach. Okay, so this is only used for those patients who are unable to absorb food. They are always vomiting. So the doctors have ordered that the patient will be put into parenteral feeding. Okay, so we have two feedings now, the enteral by the oral and the parenteral feeding, enteral is by the oral with the tube, and parenteral is through the intravenous feeding to the vein, through the vein. So this is the parenteral feeding here. So as you can see, there is the total parenteral nutrition being hung on the bottle or the plastic, and the subclavian vein being used. They inserted the vein, the cannula or the tube through this vein. So it will pass through the slit, or the incision will be there between the clavicle, dito sa may shoulder. And through the superior vena cava, passing through directly to the stomach. So this, we are giving the parenteral feeding. And to the right is the parenteral nutrition, those nutrition that contains carbohydrates, elements of fats, nutrients, and everything. So they are preparing it in the by the dietitian. So then you are going to feed the patient through the parenteral feeding. So it's not going to be this one is not going to be inserted in the same IV, yung pinagpupuntahan ng gamot. It's totally different. It's different from the one that you are giving with the dextrose. Number 7 is the housekeeping. So one of the duty for one of the fundamentals or the basics of the nursing aide is doing the housekeeping. I did not tell you that you are going to be the housekeeper in the hospital. So it is a part of your job responsibility to keep your patient care area clean, to keep your environment clean and neat and away from infection. So housekeeping as part of your nursing aide role is it refers to duties around the hospital, keeping it clean, changing the sheets, yun yung bed making on patient's bed, mopping spills in patient care areas, we will go to that. Spills, we are the one going to take care of that if the housekeeper or the cleaner is going to be busy and they are not coming to you instantly. So we have to clean also the waiting area where the patient is going to sit, and safely removing medical, domestic waste from patient care areas. The important is to create a peaceful, infection-free, and pleasant atmosphere required for the speedy recovery of your patients. So everything that you will do, the cleaning up, making it neat, everything in the environment within the patient care areas, you are helping the patient to heal, to have the fast recovery. The purpose of general housekeeping is to reduce the number of microorganisms that may come in contact with patients, visitors, and staff. Down below, you can see the photos. Okay, so these photos are different waste. Waste means those are the objects or things that we don't need anymore. So it is a waste. So we have the medical waste, and in this medical container, in the yellow medical waste, it contains, or we have to dispose all those materials, things, items that has been in contact with the patients. Okay, so all of those, masks, your gowns, your gloves, patient's gauze, anything that has in contact with the patients, you will be putting it in a medical waste. Okay, so you will see the logo of that biohazard. Biohazard means toxic. So it is infected. It can infect people. So the domestic waste are those waste like any office items, anything that is not with in the contact with the patient. Like for example, the papers, those tissues that the other relatives are using, so they are going to be put in a domestic waste. Sharps container, and it is a block. So if you will find, if you are coming inside of those healthcare facility, you be observant and you will find all of this in a proper place. So medical waste, you will find it there in the yellow container. Domestic waste in a black container. It usually comes together, the black and the yellow. And we have the sharps containers. Container of sharps means all of those sharps, those with the sharp edges, like the blades, scalpels, needles, disposable sharps, those IV cannulas, all of those sharps are being put and disposed into this sharps container. If you can see, there is a red lock. Okay, so once this one is just open in a small opening. So once it is a 3/4 full, you have to close it. It will be locked and directly the housekeeper call them and they will be stored in a waste disposal storage room to be collected by the waste contractor company. So the clean linen trolley, we have the clean linen trolley in a hospital setting. All those clean linens that are not being used, they are kept properly in this clean linen trolley. And we have the dirty linen hamper or the dirty laundry bag. So this is the dirty laundry bag when we are having or when we are doing our bed making. When we are stripping the beds, we are putting it directly to the hamper bag. You never throw it on the floor. Instead, once you rolled it, those soiled linens be put inside of this dirty hamper bag. So as you can see, we have all these segregated domestic waste and the trolleys being used for its indications. Okay, so we have the medical waste, domestic waste for the black, the sharps container into yellow. It is always fine. You will find it in the wall. It is wall mounted. You will not find it on the floor. So when you are coming inside the healthcare facility, just observe. You just look around. Where is the sharps container being placed? Where are the medical waste and domestic waste? And where are the clean linen trolley and the dirty linen itself? So number 7 in the fundamental is hygiene and grooming. Hygiene, it involves those practices performed to take for one's bodily health and well-being through cleanliness. Every day, we are taking a bath, right? So the same so as with our patients. We are providing them a good and proper hygiene. We are making sure that before the doctor's rounds or the nurse's rounds, you must ensure that your patients are already had given a bath, they already had given the good brush, they are already having put into a good grooming, like it is the art of cleaning, grooming, and maintaining parts of the body. Like in the hygiene here in the photo itself, you will find what are the hygienic process that we are going to give or to provide for our patient. So it is a bath, it is a combing, brushing of the teeth, and keeping them clean. So as the patient are being groomed, we make sure that these patients, when they are out of bed or they are still in the bed, make sure that their patient's gown are clean, they will look neat, and they will be like physically the appearance physically when the when the doctor comes inside for the rounds, they will see them as in they are already fast recovering. Okay, so that is the hygiene and grooming. So all of those, we have the 7 fundamentals of nursing that we discussed, and all of those, 7 or 8?
8, ma'am.
Okay, so it is 7. It is 7. Is it 8?
7.
I made with the mistake? Yes,
8.
okay.
8 because the housekeeping and
the
the
housekeeping.
hygiene grooming
Okay.
should
Right,
be 8.
thank you for correcting. Okay, so we have 8 fundamentals, and later on we are going to discuss each one. What are those with the bed making? How is the process? And what is there for the lifting? Those body mechanics that we need to provide for our patients. What are those housekeeping, hygiene and grooming? All of those we are going to have the lesson in every week. Okay, so we have done with the introduction to the nursing aid, and we have done the fundamentals of nursing, and we are going forward to the communication process. Okay, still you have the guts to listen. You still have the room for your brain to listen.
Yeah,
Yes, ma'am.
absolutely.
Okay, so we will continue. So give me time. I'm going to change my slides. So we have done already 2. So we are going forward to the communication process. Wait a minute. Jo, anak? Ano nga ako anak dito, bakit hindi ako na-stack up ako dito? Stack up ako anak. Oo, paano ko itong ma-enlarge? Hindi ko siya ma-enlarge ngayon. Ito. I see. So, exit full screen. Sige. Thank you, anak.